All right, so thanks again for doing this. I appreciate it. My first question to you is tell me a little bit about how you got involved in the community and just kind of your journey.
Sure. Well, speaking professionally, I'm a licensed clinical social worker based out of San Diego. And how I got started in that work was just having an interest in helping, right? Giving back to a community. I almost went into teaching and wanted to teach elementary school, but decided it was a little bit better to have more flexibility. And so I went into social work instead. And I completed my undergraduate in child and adolescent development, and then went on for my master's degree in social work. And so from there, I became a licensed clinical social worker and have been working in inpatient psychiatric hospital with adolescents, and then recently opened my private practice for therapy about 2 years ago.
hmm So let's dive into the work that you do. What is it that you do in your current role?
Yeah, so in my current role, I'm a therapist. So I have my own therapy practice. It's called Kind Heart Therapy. And the goal is really to provide good attachment-based therapy to teens, parents, families, and young adults. And recently, I also started offering ketamine-assisted psychotherapy. So I went through a training to be able to provide that to adults. And so I'm really excited to be able to offer that. So I offer primary talk therapy. And then I'm also trying to cultivate some groups as well for adolescents and for parents. So that would be for group yoga and group sound bowl healing.
hmm So tell me a little bit about the methods or approaches that you use when interacting and working with patients.
Yeah, I mean, so the approach that I use is very much discussion based. So we call that Socratic, where I'm maybe asking them questions to explore their thoughts. I'm looking at different patterns in their thoughts and how that affects their feelings and their behaviors. I work on a very strength-based perspective as well. And so I'm trying to draw out some of those skills that they may have and then further cultivate the skills that they need assistance with. So I really focus on working with communication. So trying to develop assertive communication skills, working on their relationships with other people, which highly influence the way that we feel and connect with other people in the world. And then as well, working from that attachment perspective, if it's working with adolescents, then working with how they connect with their guardians or their parents. And then again, for parents, of course, making sure that they can have an understanding of development of normal child and adolescent behaviors, and then how to come up with the approaches that make sense for them and their family on how to strengthen those bonds with their kids. So that's generally the perspective that and the topics that I try to address with the people that come to me. And then as well for ketamine assisted therapy, as well as my work with adolescents, I come from a trauma-based perspective. So I have training in trauma-focused cognitive behavioral therapy, which is used to help people who've been through difficult life events, help to cope with those events and be able to move forward. And so I do that with adolescents, but as well bring in that trauma training for my adults that might also be pursuing a way to break away from their trauma. And so that can be used through ketamine.
hmm My next question is, what impact does this kind of work have on the greater community? In other words, like doing this kind of work, what impact has it had on not just yourself, but like when patients come and see you, what have they sort of said? What have they sort of said to you in those one-on-one conversations?
So, what are they coming to therapy for? Is that more of the question?
Yeah.
Yeah, so they're coming because let's say they've had some difficult adjustments, whether they've moved from a different area, they're starting high school, they're exiting high school, or preparing for college. Maybe they've had, again, difficult life events that they have struggled to cope with, or something recent that has come up for them. Oftentimes, parents come because they have had some struggles with their parenting, and they're struggling to sometimes have a power dynamic with their children. And so that's something that they sometimes struggle with, or having a sense of family cohesion.
hmm So my last question to kind of wrap this up is, what can people take away from this conversation? How can students, entering the realm of psychology, what sorts of tools and strategies, tips, can you give them to sort of get them started on this pathway to a very interesting but challenging profession.
Mm-hmm. Yeah, well, I think getting into the field of being a therapist, you can come from a lot of different directions and a lot of different backgrounds. And so I'd say having good internships can be really important, making sure that you're actually practicing the work to see if you want to do the work. Talking with other people and networking or having informational interviews can be really helpful as well. And testing the waters out. There's lots of mobility. I come from a social work background, and so there's the micro, meso, macro level of social work that can be done in communities, working with either people, organizations, communities, policies. So there's lots of flexibility with that. And that's what I really like about social work, as well as being able to look at all the different systems that affect how we engage in the world. So I'd say just being able to try things and see what works for you and navigating through different populations to find the best suited group.
Mm-hmm. All right.